Okay, everyone, this is Desiree, and this is the pre-procedure. What you should not do before you come to me for paramedical tattooing. Paramedical tattooing is not when we do cosmetic facial tattooing. If we do paramedical tattooing on the face, it is usually to take care of a scar, maybe some stretch marks in the neck or something. Haven't seen many of those, but that's what paramedical tattooing is. If we do it on the face, it would be where someone have lost hair, or when someone has a cleft lip, or it would be if I fixed some vitiligo. Let me show you my brochure. This is paramedical tattooing. That's when I do scars, I do breasts, I do scalp. Scalp has different pre and after care. I do areolas, I do vitiligo. That's when you lose some pigment in your skin, toenails, any scars after an operation. So before you come to me, you will come to me and you will have a pre-procedure consultation. We will decide on the price and everything. You're going to come, we're going to do either clearless or we're going to do pigment on you. The pre-procedure is the same for both. You cannot tan in the sun for at least a week to 2 weeks before you come to me. If your skin is thinning and older, at least 2 weeks. If you're very young, at least a week. You cannot use any skincare if it's on the face or the body, any creams that contains vitamin C, retin A, or any kind of chemical peel. It's a big no-no. You cannot have any Botox done. For scars, you have to wait at least 4 months. If you had an operation for areolas, I know some doctors out there say you can come to me within 3 months. I want you to wait at least 4 to 6 months. I really need that area to heal before you come to me. That's now your pre-procedure, okay? If it's a scar, some doctors say 3, I say 4. Wait 4 months, because people, you don't want to wait too long, because then it's more difficult to get rid, especially if it's keloid of the scar. But you don't want to come too soon, because I don't want to cause more damage. You need that scar to heal, and then you come to me and we will decide if we're going to do some pigment on it or if we're going to do some clearless ink. Now, I will tell you that I do a lot of knee operations. People who had knee operations and it leaves that ugly scar. Be careful. Don't exercise for at least 10 days before you come to me. Don't go in saunas. Just be. This is a time to be. Okay, to meditate 5 days before you come. Just be. You will need to take a shower before you come to me, because the aftercare, which is discussed in a different video, which we can link here, you are not allowed to take any shower or any bath for 48 hours. Now, if you're someone who loves your exercise, I know this sounds like a terrible idea that you can't exercise before you come to me, and then you also cannot exercise after you've been for your first service. But think about this. You're going to sacrifice exercising, gym, those chemical peels and all that retin A. Botox, you can't have Botox. If it's in the face where I'm covering up scars, no Botox. Or chemical peels, obviously, but you'll be surprised. It's going to be maybe a month at the most, but it will be fixed for many cases for life. Sometimes it's fixed for 3 years. That's going to make your life easier, especially if it's vitiligo. Some people say vitiligo. It's going to be there, gone forever. I mean, so that's a really small sacrifice. It's very important, this pre-care. And then the most important, you will bleed. Do not take any blood thinners. Now, let me explain to you. Do you know that green tea has much more caffeine than coffee? So no green tea, no tea with caffeine, no coffee, no alcohol, no vitamin A, no vitamin E, no vitamin C, none of that for at least 24 hours before you come to me. Okay? So that is your pre-care. I am making this video because customers ask me these questions over and over. And if you are a paramedical tattooist watching this and your customers ask you over and over, feel free to share with them. But this is why I'm making this video. Afterwards, I will link the video here. You will stay out of pools, you'll stay out of saunas, but we're not going to go into that. So in a nutshell, you've got it. Hopefully this helped, please again like and subscribe. And if you know anyone who's about to have paramedical tattooing done, or anyone who do not like these scars, or anyone who had a mastectomy and would like to get rid of their scars and would like the areola recreated, please do send them this video so they can know for sure that the end result is always wonderful, and they're going to be so happy that they basically sacrificed 10 days before and 14 days after, and they'll be happy lifelong. Stay safe, happy new year, and I can't wait to see you again. Goodbye.